Hello, and thank you for joining us. I am delighted to have Renee McLeod here today to talk with us about her presidency with NAPNAP in recognition of NAPNAP's 50th anniversary. Renee, thank you so much for joining us.
Thank you. It's great to be here and to be a part of this wonderful 50th anniversary celebration.
Wonderful. So Renee, I show that your term was from 1996 to 1997.
That's correct.
Okay. Well, thanks for joining. And I thought to kick us off, could you just share with us a little bit of your journey to becoming a PNP?
Yes, and that's a kind of an interesting journey because I went to nursing school in 1973. And my program was at the University of Tennessee, and it was a 5-year program. So it was a 2-year going to anywhere to get your liberal arts and all your pre-nursing credits. And then you transferred over to the College of Nursing, which only had a medical school and a nursing school at the time and a dental school. And it was the only bachelor's program at the campus, and because it was the health sciences campus. And it was a 3-year program. And the 3rd year of the program was a leadership year, and you spent the whole year. And the university had just gotten a HRSA grant because the HRSA grants had just come out because the role of the pediatric nurse practitioner was a new role. And they didn't know educationally where it should be put. Master's programs were very rare, almost non-existent. You have to realize that in Memphis at the time, the University of Tennessee at Memphis was the only bachelor's program, and literally there was a diploma program on every corner. And so they got this HRSA grant, and the HRSA grant was for a PNP program, which their plan was to see what it would be like as part of the undergraduate program. But this 3rd year, it was a 15-month program. And because there were no nurse practitioners at the time, there were 5 of us that were accepted into it. We had to apply for it, that were accepted into it. And that became our 3rd leadership year, our senior year in nursing school. And we actually did it with the 6 pediatric residents. And we did a 1-year pediatric residency. It was full-time in the residency. We rotated through every single specialty, and we did 1,650 clinical hours in that 15-month period. And we had lecture in the afternoon with the one nurse practitioner faculty who was there, but she wasn't practicing as a practitioner. She had just gotten her master's degree. While I was finishing up that program, there was no certification. There was no special licensure. You just got licensed as a nurse back then. Well, so I did a whole year of practice with the pediatrics. There were some things that I missed. That the first thing is one of my very first patients that I had was a 12-year-old that was pregnant. And I realized that we weren't getting any education in pregnancy or women's health. Like there was nothing, because pediatrics at the time, and still don't, do very much of that anyway. They don't do GYN. They don't do any of that. I applied for my master's degree while I was in my senior leadership year to go to UCSF. There were almost no programs. I got accepted at UCSF, one of the few master's programs, and went from Memphis to San Francisco to start my master's degree. I finished my nurse practitioner program on a Monday, and the next Monday I started my master's degree. So I did 7 years straight through. Because I was already a nurse practitioner, the UCSF had also gotten one of those grants, and they had put it at the master's level. So they had a master's PNP program. So what I decided to do was to audit their classes, because they had a lot of didactic instruction. They only did 200 clinical hours to get your master's degree and become a nurse practitioner. So I had all this clinical experience, but not as much didactic and research. They were getting kind of a little bit of both, but not very much in my mind. They didn't do very much clinical. So I audited that. That allowed me to take all my other programs, and you could audit at UCSF. You could take classes out of any school, out of the School of Nursing, School of Medicine, you go anywhere. So I put together a developmental pediatrics program with an emphasis on developmental pediatrics, but I also took all the classes out of the midwifery program so that I could get all the women's health and GYN courses. So I graduated with my master's degree, and really at the time, nurse practitioners, again, I got a license in the state of California as an RN. there was no, I mean, if you really think about it, all we've done in the last 25 years is almost 40, 50 years has added more restrictions to practice. There were no limitations on practice. I could practice in the hospital in acute care. I practiced in primary care. I had such freedom because there were no restrictions. So it was really kind of an interesting time to become a nurse practitioner, but it was wonderful for me. My master's information was and research was on child abuse, physical abuse, which was really getting recognized in 1976. And I finished my master's degree in 78. So that was kind of my journey. So it's both how I wanted to go into pediatrics. I wanted to be a nurse practitioner. That wasn't, I mean, I didn't go into nursing school, wanted to be a nurse practitioner. I didn't know what that was. But as soon as I found out what it was, I always knew I wanted to go into pediatrics. So it just was a perfect opportunity for me. So, and it's been an amazing career. So I actually started teaching right away. So I've also been teaching since 1977 because I was already a nurse practitioner in the skills lab. I taught the medical students while I was in the master's program at UCSF. So I've also continued to teach medical students throughout my career and nurse practitioners and nurse practitioner students. But it's just an interesting time to watch really how our practice has actually gotten restricted, which I'll talk about again, because in 1996, we were dealing with scope of practice issues again. So we'll talk about that. So that's one of the things I feel like I fought for my whole career.
That's fascinating, Renee. So you were really at the cutting edge there as education was evolving for nurse practitioners, and the fact that you sort of designed your own program in a way. So you came from sort of more of an apprentice model, moving into the master's program with that balance in didactics. That's fascinating.
Yeah, I mean, it ended up being a great education, and I've always striven, done a lot to work on PNP education. That's where I've spent the last 20 years of my life, and really looking at just education for nurse practitioners and finding that balance between where we go in clinical practice and clinical practice hours and where students really get that information that they need to practice and how you balance that with the didactic that you're getting in the classroom. And of course, all the current issues on preceptors, all of that comes back because some of that was a problem in 1973 because the only preceptors were physicians. And that was not a model that I wanted to do, so I fought against the fact that it should be nurses, teaching nurses, that we did practice in a very different way than the physicians. So, and I felt that very strongly, even though my mentors at the time were physicians.
That's so interesting, and that it's really a major topic of discussion / contention right now. The number of clinical hours and precepting and such. Wow. So we've heard from you about your educational journey. I'm wondering if you could now shift gears and share with us, how did you find yourself moving into the NAPNAP presidency?
Well, that's really, I because I was so early on, really right away, as soon as NAPNAP was out there and I found out about it, because NAPNAP obviously had come into being very small in one area of the country. I was in California. And so finding out about NAPNAP as an organization, as any kind of, the only nursing organization that was really out there was ANA, as far as I was concerned. So, and it's not like we had internet or any kind of ways to find out stuff. You had to kind of, I don't even actually know exactly how I found out about NAPNAP, but I joined as soon as I could. As soon as I found out about it, I joined. It was before PNCB has started doing certification exams or was even in existence. So I was also in very early into the NAPNAP organization. For me, NAPNAP over those years, my husband was in the military. We moved every 2 years for 26 years, and NAPNAP was critical for networking. I went to every conference because I could meet people. I found out during that time they started having, they had grown big enough that they started having state chapters. So I would get involved with the chapter. I would find out as soon as I knew where we were moving to, I would find out who was the president of the next chapter. How could I join that chapter so I could find out about jobs? I could find out about housing. NAPNAP became this home for me that was critical. And because of that, I became very active in the local chapters. So every chapter I went to, I also became active in their local, in the leadership. I actually chaired 4 state chapters as president over the years. And that experience also then led me more into become onto committees at the national level, and then on into the leadership role as president. So it was NAP for me was not just a professional home, it was a home for me to find, it was a continuity that wasn't available any other way, for just finding jobs, for finding like-minded colleagues. It was an incredible help for me. So that journey made very good sense to move through the organization. And I would encourage all members now to use NAP. It's one of the biggest advantages that you have is this group of colleagues, and to find out more about different areas. Now, not everybody's moving like I was, but it was a great experience.
That's fascinating, Renee. So, we hear this often from members that NAP is their professional home, but I like the way you said that it's really your professional community, and it's that network that's really helped sustain you in your career. And I'm going to have to check to see if you hold the record, because I don't know of anyone else that has served as president in 4 different chapters. That's amazing.
Yeah.
So, go ahead.
No, I was also president when one of the chapters had to fold. So because we couldn't keep membership. So I've been through the whole experience at the chapter level too, that many of the chapters are still experiencing on how difficult sometimes it is to find leadership. I mean, some of these chapters have had the same president, or just this, 2 or 3 people exchange the 3 roles, over and over again for years, without bringing in a lot of new blood. And that can be so challenging. So I've lived through all of that. That chapter did come back later, which was great.
Well, I'm wondering, Renee, if we can now zero in on that presidential year. Is there a particular issue that you recall being of the utmost importance to the PNP profession and or NAP during your term?
I took some notes. Like I said, it was very interesting for me to really look at what's happened over the last 20 years and to go back and look at what was going on during my time. And I think the biggest concern for me was this fight for recognition as a nurse practitioner, which we are still having. But you've got to realize that in 1996, one of the things that was going on was managed care was just coming to the forefront. And in 1997, which is during my presidency, the Balanced Budget Act of 1997 occurred. And that's when nurse practitioners were recognized as providers, but were not given equal reimbursement authority. And of course, all the insurance companies were going to do whatever Medicare, Medicaid did. So that was a critical. So at the beginning of my presidency, we were really working and advocating for nurse practitioners to not become invisible providers, because we could not hold our own panel of patients. We were billing under physicians. We had no way to justify that we brought value to a practice because we had no way to show the income and what was coming in. And that was a big concern in 1996, was how can we be recognized as providers that have value so that practices want to have us, in the practice. Also, the state boards of nursing had also decided during that year that they were going to require a second licensure for advanced practice nurses or for nurse practitioners. And we were really fighting against that. We already had a certification body. We had a great certification and maintenance plan that was there. We said, why would we need a second exam that the state board did, like an NCLEX for nurse practitioners? And that was one fight we won. So that was a good thing because there was no reason to do that. So, and actually we were against the term advanced practice nurses at the time. So it's interesting to see how that's evolved over the years. But at the time, that scope of practice was trying to use the word advanced practice nurses, but on the Hill, we were trying to get everybody to use the term nurse practitioners because of this Balanced Budget Act that was coming out. That was about all nurse practitioners. We wanted that term, everybody to use that term. We didn't want to introduce advanced practice nursing at the time because it was going to water down what we were doing on the Hill with our legislative efforts. So it was a very interesting time with trying to get everybody together in some ways, and then having a lot of different organizations not really on the same page with some stuff. And I think some of that continues today. I mean, that's not anything that's too different, but those were the big things, I think.
Well, that's plenty. That's a lot. Thinking about how to really affirm the legitimacy of our profession, through so many different venues and settings. I'm wondering if we could revisit, as you were talking on the Hill, about this policy and advocacy work that you were really focused on during your presidency. Could you tell us just a little bit more about that?
I've always felt that our legislative efforts have been one of the biggest things that NAPNAP does. And at the time, we had a lobbyist who was very good and was working together. But again, a lot of our effort at the time was to say, it's very hard. Our organization at the time represented about 5,000 members. But we had American Academy of Nurse Practitioners, we had other nurse practitioner organizations and advanced practice nurses. And we knew that it would be better if we could go as one voice. When your competition is the AAP or the AMA, and you've got an organization that only represents 5,000 members, it's very hard to feel like you have an effect on the Hill. We need to be together. So a lot of the advocacy at the time really was working with these other nursing groups to help create a single voice. And I think that nurses and nurse practitioners as a whole have done a great job of that over the last 20 years, of really recognizing that on these big issues like reimbursement and scope of practice, we need to come forward as one voice. But more importantly, we wanted to be seen on the Hill as the experts and advocates for children, because none of the other nursing organizations and advanced practice and nurse practitioner organizations were advocating for children. And I think the other key legislative advocacy that we do is around children. And then in that respect, the AAP was kind of our who we wanted to join together in a single voice, right? And there were quite a few things that we came together on, actually, on the Hill with the AAP, that we could come together and say, yes, as a group, all of us believe in the same things. Child abuse was a big area advocacy at the time. So.
That's so interesting because, we see that pattern still today where, yes, we do join with the AAP on many issues, but we don't see eye to eye on everything. And so it sounds like that was certainly your experience as well. I'm wondering too, you did touch on this, but were there, what particular education, certification, or workforce issue do you remember being sort of front of mind during your term?
Well, some of the things that are still front of mind. It's so interesting to read the articles in this month's journal because some of the same things. We were fighting for funding for nurse practitioner education to be equal with the graduate education for physicians. And that is in this month's article in the journal. Is like, wow, we're still fighting this fight. And so a lot of this was around funding for nurse practitioners, trying to get more nurse practitioners, particularly pediatric nurse practitioners, into the workforce. We've continued to have this issue, and I think that that's probably one of the biggest ones that's been out there. So that was probably the biggest one that we were doing on the Hill, was really advocating for funding for nurse practitioner education, and really working also with reimbursement for education. If you couldn't get initial funding, reimbursement for education for those nurses that were serving in rural and underfunded areas.
Well, you're so right. Those are still very prominent topics from an advocacy perspective still today. I'm wondering, Renee, if you can share, are there any particular challenges that you recall looking inward within the board during your presidency?
Well, I think that all boards have political issues and differences between one leadership and the next leadership and what they want to focus on. And I think that that's a leadership skill that you learn to negotiate. And I don't think that I certainly didn't feel at the time that I had been prepared for how you manage a board, how you pull people together behind you. In fact, one of the very first articles I wrote in my as a president was collaborating and coordinating together, not just in our board, but across the membership, and that a leader is only as good as the people that they're working with and the people that are there. That communication is so critical, that as a leader, being in touch with the membership and knowing what they want, because you need to be representing your constituency. Like, isn't that an issue right now that we're hearing plenty of? And that's true even on an advisory board. And I think that we continue to work on how can we communicate better with each other as a board? How can the board communicate with the membership? How do we have access for the membership to let the board know what their concerns are? So I think that continues to be a problem, but was certainly one of the things that I dealt with.
Well, I can attest that continues to be sort of the ever-present challenge, is how do we ensure that we are representing our members and honoring really that diversity of thought and expertise that the members of the board bring. So yeah, excellent insight. I'm wondering now, Renee, if we could shift a little bit and give you the chance to share if there's a memorable experience during your presidency that you would like to share with us.
Oh, there were so many things, but I think that I think one of the most interesting things that happened to me as a member is that I had this new NAPNAP member come up to me during the conference while I was president. And she came up to me and said to me, I just want to meet you, and I want to know if I can precept with you. And I said, wow, how amazing it is that a new member in MAPMAP was confident enough to come up and talk to the president of the organization. That made me feel good, because I felt like, okay, at least I've let people know I'm approachable. I'm not like I'm a normal person out there, and wanted to know that she could come out there. My first question to her, because in 1996, we didn't have online programs. They were all face-to-face programs, and we didn't have any. And I said, what nursing program would let you come to California? I mean, are you from California? Do you live in San Diego? And she was like, no. And I was like, well, how can you go there? Well, I don't know. Her comment was, my mom's a lawyer and we're going to figure it out. And you know what? She did. And she got permission, and she came out and spent the entire summer with me doing precepting with me. So, and even today, she's like a very close colleague and friend. We've stayed very close. So, but there were just so many other, I think that the people, the members that you meet, and the connections that you make when you're president are just so important. And I don't think that we let our membership know that while the presidency is so much work, the rewards that you get from that time are just they're invaluable. Those connections. That was the first time during that time when we were actually encouraging nurses to be on advisory boards. And I got invited to several national advisory boards coming off that presidency. So it was a great experience.
That's wonderful. I'm wondering, Renee, if there was a unifying issue that rallied PNPs and other NPs to join NAPNAP during your presidency.
One unifying issue? I think the whole scope of practice and managed care not becoming an invisible provider was a pretty compelling issue. Nurses and nurse practitioners, particularly PNPs, really wanted to be recognized for the work that they were doing in the practices. That was really, really important. And I think it's still important today. We don't want to become invisible providers. We don't want somebody else to take over our roles. And I thought so, and that scope of practice is out there again today. The fact that we're having an issue on, is it time to educate acute care and primary care PNPs together again, is just an example kind of that constant evolution of practice to meet this constantly changing healthcare environment. And I think that NAPNAP has done an amazing job of staying on top of that constant healthcare change and that basically changing role of the nurse practitioner as we've moved through the years. I'm very proud of NAPNAP for that role that they've held.
Well, you and me both. And that segues us beautifully to my next question, which is looking back on NAPNAP's first 50 years, what is something that you are especially proud of?
Well, I think that I'm most proud of our advocacy for children and the changes that we have supported and what we've done for all kinds of healthcare for children and the role that we've played in that advocacy. I don't think there's another pediatric organization that has done that besides the AAP, but certainly no other nursing organization. And I think I'm most proud of NAPNAP for that over the years. They've just done an amazing job.
I agree. So now, Renee, given your amazing tenure as a pediatric nurse practitioner and leader within our profession, what advice do you have for our emerging and future NAPNAP leaders?
Get involved. Start at your local chapter. Get involved with your local chapter. Get on committees. Be involved. Even if that's agreeing to read over a new white paper, to be on any small committee. I think that if nothing else, making sure your voice is heard. Don't sit out there by yourself and complain. If you have a concern, if you have something that you want NAPNAP to do, every nurse practitioner that's a member should be making their voice heard to the board, to the organization, so that we can move on. It's the membership who's in practice, who's keeping us in touch with what the issues are, what our patients are concerned about. And that's how we've stayed responsive. And so I'm really hoping. It's really hard. I understand the challenges that the workforce today has, all these young women who, I'm still teaching. I see all the issues that you're having trying to go to school, especially get your doctorate, work full time, raise your family. My own daughter said, I'm not going to do that. You did that for me, so I don't have to do that. But she still is involved she's a pediatric nurse. She's still very involved in her organization. And I think that that involvement and that communication is so critical. And that's what I would say to all members, that don't just sit back, really become involved. And it's really a challenge now because there's a lot of organizations to be a part of. But I hope that you would pick NAPNAP as your personal, professional, first on your list nursing organization to work with and to be active in.
That's wonderful. Now, looking inwardly, Renee, if you were to go back in time and share some wisdom with your younger self, what might that be?
I would say it's going to be an amazing journey. It's an amazing career. And just keep doing the same. I would do it all over again. I would just be less stressed and take deeper breaths. More breathing, more self-care. But otherwise, I'd stay on the path.
That's lovely. Well, Renee, I wonder if there's anything else that you would like to share that perhaps I haven't asked you about.
No, I think this has been very comprehensive. I'm so excited to be sharing the wisdom that I've had and leadership skills that I've had with the organization as we move forward and celebrate 50 years. It's been 50 amazing years, and I'm very excited to have been a part of that.
Well, thank you so much for your service to NAPNAP and to the pediatric and nursing profession. We were just so indebted and really grateful to you.
Thank you.